Hi, my name is Carolyn Eckerly, and I'll be going through my mock interview trial. I'll be reading the questions and then answering them as I go. What are your short and long range goals, and how do you expect to achieve them? So, starting out for my short term goal is to graduate with my FNP and pass my boards. My goal is to transition into a strong FNP role where I can continue developing my clinical skills, learn from experienced providers, achieve my 750 hours of prescriptive authority in Colorado, and then start working at a practice in primary care. My long term goal, I hope to eventually own my own practice in a setting that emphasizes prevention, education, integrative medicine, finding the root cause of disease processes. I plan to achieve this through mentorship, continued education, and a commitment to lifelong learning and asking questions from experienced providers to help me achieve these goals. What motivates me? I am motivated by helping people improve their quality of life. I find people incredibly touching and rewarding with their stories, and I like to educate and empower them to take ownership in their own health and see positive changes in their outcomes. I'm also motivated by continuous growth and learning in my own health experience and sharing that experience of growing and understanding how to better take care of yourself. What does patient-centered care mean to you? To me, patient-centered care means treating the whole person, not just the diagnosis. It means asking questions, active listening, understanding every story is different. It involves listening to patients, understanding their goals, their values, and then partnering with them to meet their realistic goals of care that really fit into their lifestyle. How do you interact with families and patients? I've always found that I like to create an environment where people feel safe. I focus on building trust through empathy, that active listening, clear communication, being kind. I want patients and families to feel heard, safe, informed, and always comfortable to ask me questions so that they can actively participate in healthcare decisions, ultimately improving quality of outcomes with shared decision making. Tell me about your greatest achievement and your greatest disappointment. My greatest achievement to date would be achieving as far as I've come in my education, completing my FNP education while working as a nurse across multiple specialties, learning from so many mentors and other nurses, continuing to grow professionally. It has required so much discipline and resilience and adaptability and patience with myself. To date, I would say that is my greatest achievement, and I'm very proud of how far I've come in my work ethic in getting here. My greatest disappointment, I would say early in my nursing career, I often felt limited in my ability to really stay in one specialty. And at the time, I've always looked at it as a disappointment in myself for not being that nurse that stays on the floor and works in that specialty and becomes, novice to expert. So I would say ultimately, that has in the moment felt like a disappointment, but in hindsight I can look at this experience and understand that working in different specialties has made me such an adaptable nurse. It has given me so many different perspectives, and that frustration ultimately motivated me to pursue becoming an FNP so I could have a greater impact on patient outcomes. Tell me about the best and worst bosses you have ever had. The best leaders I've worked with were approachable, supportive, invested in their growth, in my growth, and the growth of the team. They've really committed to, discipline and helping me learn my strengths and weaknesses and challenging me to address reflective practice constantly. The most challenging leaders, I would believe, has been some of my travel nurse managers just struggling with communication and consistency. And I understand that that could be a difficult position because you're working with so many nurses in short periods of time. There's such a turnover. So giving them grace and just understanding that those experiences have taught me transparency, teamwork, resilience, adaptability, and focusing on taking responsibility for my own practice as a nurse. How do you handle stress? I like to stay organized. I like to prioritize tasks and focus on what I can control. Outside of work, I have a really good self-care regimen where I exercise every day. I like to exercise in the morning to really help with neurotransmitters and stimulate, any kind of stress response, combat that with exercise. I do a lot of yoga. I teach yoga. I like to give back in teaching yoga, and that's a very relaxing outlet for me. And then I also love to spend time outdoors to recharge, spend time with my dogs and my family and my friends to maintain balance, especially during a very hectic 3 years of school and work. I've really learned to find these healthy outlets. What am I looking for in this job? I would say it's really important. I love a team environment. I played soccer in college. I've thrived in being a teammate and in a collaborative environment where I continue to grow as a provider and learn from experienced clinicians. I like to build meaningful relationships with patients and my team, and I feel like that ultimately contributes to better patient outcomes. Communication is better when there's trust in a team, and I feel like this has a positive outcome overall on a practice and on the clinicians in the practice. What constructive criticism have you received from employers? I have definitely been told that I tend to take on too much responsibility. I like to stay busy. I'm highly motivated and I always want to jump in and help when I can. So over time, I've learned that less can be more sometimes, and focusing on one task at a time, staying organized is really important for me. I've learned from that criticism that those methods of adjustments, like staying organized and prioritizing tasks, are things that I focus on and have focused on that really help me as a clinician. Over time, I've also learned the importance of delegation, teamwork, and using your resources effectively. So that criticism ultimately has helped me re-navigate how to better practice and be a teammate and take responsibility for my practice and my patients. Why did you want to become an FNP? This goes back a very long time for me. I was young and saw doctors and nurse practitioners take care of my family, and I knew that I wanted to be in that role and be able to provide that same support and care that was provided for my family. As a nurse, I've always loved educating patients and building relationships. I've always been someone who wants to talk and get to know people and make them feel safe. I knew that this greater role, I would be able to provide that environment for patients, use clinical decision making, prevention, manage chronic diseases. I've always loved science and the why and getting to the root cause of health. So this has always been in my nature, but this route has been years in the making, graduating nursing school in 2019 and then starting FNP school in 2022. And I've always wanted to be in this role and knew I was going to get here at some point. Becoming an FNP allows me to combine my nursing foundation with my passion to be an advanced clinician and give patients the knowledge to ultimately have better long-term health outcomes. And that concludes my interview.